It's 8 a.m. from Fox 35. This is Good Day Orlando.
Coming up next, a plastic surgeon joins us to talk about the most popular procedures and things that you need to keep in mind if you want to change up your look. All right, on the Health Watch, the popular belief is that women are more comfortable with plastic surgery than men. However, according to some 2014 statistics released by the American Society of Plastic Surgeons, the number of men getting cosmetic procedures continues to rise. More and more men want to regain that youthful look, improve their self-image, and just feel better about their overall appearance. Plastic surgeon, our good friend, Dr. Armando Soto, joins us to talk about it. Always good to see you. Appreciate you being here. It's interesting. It used to be a woman thing, right? Are you seeing more men in your practice?
Definitely. I think that guy that was driving that truck probably needs
he could use a little work.
Yeah, we're doing some more stuff on guys. I think men are generally more aware of how their appearance affects their overall state of happiness and their life.
What's the number one thing you hear when a guy comes into your clinic?
Well, I think the two most common things that we're seeing now are guys being more interested in the appearance of their skin, their facial appearance, and body contour stuff, love handles, little areas of excess fat that they're not happy with.
What are some of the more common ones? You talked about the love handle. So obviously men get work just like women around the midsection. Yep. Is that the most popular thing, or is it Botox? What do you see?
Well, I think Botox is probably the most popular thing because it's so simple to do. It's just an office treatment. It takes a few minutes, doesn't really take a lot of time out of your day. But we are doing a lot of body contouring on guys, for sure.
It does seem like I've seen a lot of stories here recently about men going in for the breast reductions, whether they've lost a lot of weight. Something you said during the break, guys worked out a lot when they were younger, they can't keep it up, and now they have breasts. Is that as common as we're being led to believe?
I don't know that it's epidemic or anything, but it does happen quite a bit. It's not rare, for guys to develop an uncomfortable or unmasculine appearance in the chest, and they want something done about it.
What do guys? Are there differences when it comes to guys getting plastic surgery versus women? Are there things that we need to know about?
You mean in terms of what we do, or in terms
just
of
the recovery,
goals,
maybe the goals, or just how the whole process works for men versus women?
I think when you're talking about facial intervention, there are definitely things that need to be done differently because you don't want to feminize a guy's appearance. But when we're talking about body contour, it's really just about achieving, maximum harmony between the patient's goal and what we can do and keep it looking natural.
I think with men, too, as we get older, that's true with women, too, but you can tell when a guy has had bad work done. And I think that's the fear for a lot of men is, I don't want to look plastic. I don't want to look like a freak. Let's be honest. They say, I don't want to look like a freak. What's the problem there?
A lot of times it's that they've been feminized. The technique that was performed on them was not really that much different than what you would do on a woman. And so it ends up making them look excessively feminine. And that would be, the Kenny Rogers effect, the Burt Reynolds kind of thing. And that's what guys don't want. You want it to look natural. You want it to look still masculine, just younger.
So if a guy wants to come in very quickly, get some work done, just look younger, maybe for his job, he's competing against younger people in the workplace, what's something quick a guy can get done to maybe help him improve
There's
a little bit?
Lots of great options now, especially, one of the things that commonly happens to men as we get older is you develop a little fullness under the chin here.
Right. A lot of guys deal with that.
Yeah.
The waddle,
really,
right? You know what you call it, the waddle?
Yeah, a little fullness there. It's really easy to deal with now. It's just there's 3 or 4 different options depending on what your individual problem is, but it's really simple. They're all office treatments.
Yeah, that's just a machine that they put under there and tightens it up, right?
One of those, there's a treatment that's just a simple injection. There's another treatment that involves some ultrasound. All of them are effective for that area, and none of them require any downtime.
Well, it seems like the stigma is going away for the guys anyway.
I think it's great.
All right, Dr. Armando Soto. Hey, what's your website in case people want to check you out?
It's drarmandosoto.com.
All right, thanks much.